Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again this morning. Going to be speaking with Dr. Diane Newman, urologic nurse practitioner from the University of Pennsylvania, and she's going to talk to us about overactive bladder. Welcome to Health Professional Radio, Dr. Newman, and thank you for taking the time.
Thank you for having me, Neil.
Give us a little bit of your background and talk about your role there at the Penn Center for Continence and Pelvic Health.
Well, I've been at the University of Pennsylvania now for 20 years, and I practice in urology. And I see patients with overactive bladder and other bladder dysfunctions. I've been doing this since 1986, actually providing interventions such as medications, behavioral treatments for bladder problems.
So what is overactive bladder, and why is it such a concern?
Well, overactive bladder is a bladder condition. Sometimes we call it OAB. And basically it's unwanted bladder contractions. It's a very prevalent problem. Over 30 million Americans 40 or older have the problem. We see it in both women and men, but primarily we see it in women. And it's very embarrassing. It's really a stigmatized type of condition, and women wait years before they seek treatment, which is why I'm here on behalf of Stellis to really bring awareness to this problem.
Is it something that is caused by age, or is there some other cause?
Well, we actually see it as women get older, but just because you're older doesn't mean you have to have an overactive bladder. We start to see actually an increase in symptoms during the menopausal years and then as we get older.
Are some people more predisposed?
Well, as I said, we see it in both men and women. We see it in men who may have an enlarged prostate, but we also see it really primarily in women. And, the sad thing about it, it's really a hidden problem. Women are not aware of different types of treatments available, so they hide it and they self-manage their problem.
So what types of treatments are available, and what is the problem with self-medications or home remedies? Well,
first I should probably tell you about some of the symptoms. Symptoms of overactive bladder include bladder urgency, that gotta go feeling, and also frequency, which means that you go to the bathroom more than 8 times during the day, and they also may have urinary leakage or urinary incontinence. And there are many treatments available, and I'm glad that you asked that. There's some simple things such as modifying your diet. There's some things that we drink or that we consume that might irritate the bladder. A common thing is caffeine, which is in a lot of foods and liquids such as coffee, tea, sodas, and sometimes large quantities of that or even just a cup can irritate the bladder. There's also strategies that control bladder urgency, that gotta-go feeling. And also there's pelvic floor muscle exercises or Kegel exercises. And by strengthening the pelvic floor muscle, you can actually prevent urine leakage.
Is there any way that you can, relax the overstimulation with flushing it out with water, drinking more water or something like that?
Well, water will not get rid of overactive bladder, but there are other treatments. And that's why I tell men and women to really seek out treatment, consult with your healthcare provider. There are medications that actually help the bladder store urine, so those can also be very effective. I really think the informed person is really the person I like to see, so I suggest that, people go to the internet. There's a great website called copingconfessions.com that can provide more information. Also, you want to seek out advice, okay? So you want to go to your healthcare provider. And one of the things that I think can be helpful is by keeping a diary. We keep records on, say, what we eat for, weight control or weight loss. So keep a diary about your bladder habits, like how often you're going to the bathroom, if you have bladder urgency, that gotta-go feeling, if you have any incontinence, and also what you're drinking. And then you take that record to a healthcare provider to consult with them about possible treatments.
You mentioned stigma, of course. Obviously, there would be some, but what about getting the conversation started with your healthcare provider? If it is that uncomfortable conversation, what can the physician do to facilitate that conversation more comfortably for the patient?
Well, you really brought up a good point. I find that healthcare providers are reluctant to talk about it, and patients, especially women, are embarrassed and they don't want to bring it up. So that's why, I suggest, number one, bring in a record. I always tell my patients and also my family members that if you write down your questions when you come in to see us, we tend to stop when you bring out that piece of paper, and say, I have these problems. So I really suggest that you learn about your overactive bladder problem, see if you have the symptoms. Go to the internet, go to copingconfessions.com and learn more about it. But, in this time that we're in right now, our essential workers, if they have overactive bladder, I often wonder, how are they dealing with it? Nurses have to put on these PPEs, right? They have to have masks and gowns. And what if they have an overactive bladder? Because some women tell me that they have to go to the bathroom's office every hour. I don't know how they're doing their jobs. They have to go take off all that, the gowns and the mask and that to go to the bathroom. To do that frequently can be a real problem. And a lot of them do something, they restrict their fluid intake. I actually have nurses and some of my patients in retail that they have to go to work because they're an essential worker, and they literally are not drinking because they're so worried they're going to have an overactive bladder problem.
Can just literally drinking too much fluid, not necessarily caffeine or sugar or even water, but just fluid itself, is that something that can cause an overactive bladder and cause it to be a chronic problem?
No, in drinking too much fluid or not enough really does not, cause a problem. And so you're right, a lot of people are drinking water, they may be on weight loss programs and that. It's true that if you drink more, you're going to have to go to the bathroom more, but that does not cause an unwanted bladder contraction. So that does not cause overactive bladder. I recommend that on average people drink 6 to 8 glasses of some type of fluid during the day. So, and also the thing, you shouldn't restrict your fluid. A lot of my patients will say, when I come to see you, I won't drink anything that morning because I don't want to have to stop and use the bathroom on the way to my office. Not drinking too little fluid also is a problem because you can actually concentrate the bladder causing problems. So, you want to have a nice fluid intake. So don't restrict, but, don't drink too much.
Now, obviously, you're here with us this morning talking about OAB, but how is University of Pennsylvania Penn Center for Continence and Pelvic Health more involved during Bladder Health Awareness Month, November? Yeah,
no, you're right. November is Bladder Health Awareness Month. Well, we're trying to get the word out, and that's kind of why I'm here. We really do want women and men to be aware that there's treatment for this. There's help for this. Don't just live with an overactive bladder or, as you said, OAB. Seek out your healthcare provider. Bring it up maybe on your routine visit or make an appointment and talk to them about it. Because, I think what most people think is, I have to live with this. There's nothing I can do. And there really are effective treatments that do work. And I hope the message comes out that to your listeners that really there's help. So just don't live with it. And just because maybe you're getting older and you're seeing more and more of a problem doesn't mean that, hey, there's nothing I can do about it. There's lots of things to do. So I'm really glad that you're bringing this forward.
Now, you did mention some web resources. I understand that there's another one, Coping Confessions. Is that one that we can go to? Is that another website?
Yes, that's a great website, copingconfessions.com. There's really a great deal of information on OAB there. It talks to you about the causes, what you may be experiencing, as well as treatment options. So I really feel the best patient is an informed patient. So really go to that website, copingconfessions.com, and learn about your condition so that you are informed, so that when you go see your healthcare provider, you can share with them what you're experiencing.
Dr. Newman, it's been a pleasure speaking with you this morning here on Health Professional Radio. I appreciate your time.
Thank you very much for having me.